Hello everyone and welcome to this training video on how not to miss a fracture in A&E. This radiograph is for a 58-year-old female who had a previous right total hip replacement, as you can see on the radiograph. She came to A&E with hip pain. This was examined by the registrar on call and also by the SHO. The patient was sent for X-ray. Patient came back and was discharged because no X-ray abnormality was found. Specifically, there was no fracture detected on the X-ray or reported on the radiograph. Obviously, this is missed fracture and missed opportunity to treat this patient in a timely fashion and avoid complication. Patient went home and came back on the second day because the pain has worsened, but also was examined by a different team and another X-ray was performed and no fracture was found. And this is because a simple rule in radiology in detection fracture was not applied. It's a simple rule where it advises doctors or whoever is reporting or assessing a radiograph for a fracture to follow a simple rule, which is to follow the cortices of all bones on the radiograph carefully and slowly, looking for any steps, sclerosis, or any lucent line, or any cortical irregularity of that radiograph. So let's do this now and see whether you're going to find fracture or not. I would suggest that you start the arc by examining the inferior aspect of the pubic body on the left side, and then keep going on the left side. Make sure you go slowly and follow the acetabular border, and then follow the iliac side laterally, superior laterally, and then superiorly. And when you come to the sacrum, make sure that you look at the sacrum in a different way because you've got some overlapping from the vertebral body here. So you have to make sure that you are skimming this area carefully, giving it more attention and time. And don't forget to look at the vertebrae because you could get vertebral fracture. So you need to make sure that the spinous process are all aligned and there's no fractures. And also look at the transverse process, make sure there's no fracture. And make sure that you can see these oval shadows that represent the pedicle because you may get pedicular fracture presented by loss of the oval shape. You then continue to the right side and make sure that you follow the borders of the bone until you go all the way down, and then continue to the inferior aspect of the pubic bone till you reach the pubic body. Then you got these two eagle eyes that you have to make sure that they are complete without any interruptions or steps right and left. And now you follow again from the superior aspect of the left pubic ramus, going all the way to the left side, and make sure you follow it with a cursor, with a pen, with a hand, but don't follow it with your eyes only because you will miss pathology. And now you all have access to PACS and you can do this quite easily where you're practicing every day. When you come to the inner aspect of the sacrum, you need to make sure that these arcs are nicely and smooth without interruptions, and keep following the inner aspect of the pelvis here where you shouldn't see any steps. Now, we need to follow the femoral bones. So we start from the lateral side and then go all the way to the greater tuberosity. So you start from the inferior aspect laterally there, go all the way up, make sure there's no steps, and you check the greater tuberosity for steps or fractures, and then femoral neck, and make sure that you are following the trabeculae nicely and easily there, and then follow the femoral head all the way back to the neck and all the way down. Applying the same rule here, you find that there is no cortical steps or abnormality, but as you go to this point there, in the greater tuberosity, again you see some irregularity but no fracture. But when you come down here, you can see a lucent line. And you would only see this if you followed this rule when looking at X-ray to detect fracture. You have to follow all cortices. Unfortunately, this patient was missed on the first day. As I said previously, was got the second day. They did a lateral radiograph and they couldn't see the fracture. Although if you apply the same rule, you could follow the cortical line here and all nice and smooth with no steps or abnormality. As you come to this border and go all the way up, you can see double cortices. And this is abnormal. How would you see double cortices unless there's a fracture? So this is a missed fracture opportunity. The other mistake that was also contributing factor is on the first day, only one AP radiograph was obtained. And as you all know, one view is too few. So you should make sure that you are looking at two orthogonal or two different views of the same patient of the area of interest. Otherwise, you miss a pathology like this one was missed. I am confident that now you are going to be more skillful in detecting such difficult fracture, especially when the patient presents with persistent pain for the second day. Don't take it lightly. Make sure you follow the lines of the cortices and make sure you look at double images. Please make sure you share this case with your colleagues and share the learning experience, and make sure you comment on this video to enhance learning from each other and to improve on your successful journey. Thank you for your time and see you on the next training video.